Welcome to Module 2, Why Falls Happen. By the end of this module, you will be able to identify what puts an older adult at risk for falls. Let's take a moment to think about why someone might fall. You probably had no difficulty identifying more than one reason why people fall. The research tells us there are many reasons, also known as risk factors. Let's look at these in more detail. There are multiple risk factors for falls, and they do not exist in isolation. They are complex and interactive. Some you can change, and others you can't. The risk factors can be divided into four main categories: personal and medical, behavioral, environmental, and social and economic. Let's take a closer look at each of these categories. The first category is personal and medical risk factors: genetics, the natural process of aging, chronic or acute health problems, or a combination of all of these can increase the risk of falls. Women fall more often than men, 54% versus 46%, and sustain more injuries, 64% versus 36%. Having a history of falls is one of the strongest predictors of having a future fall. Acute illness like an infection can result in a variety of symptoms like weakness, fatigue, pain, and dizziness. Chronic conditions and disabilities like Parkinson's disease, arthritis, hypotension, urinary incontinence, or stroke can affect mobility, gait, and balance. Any balance and gait problems can result in instability. Muscle weakness is one of the most important risk factors, increasing the risk of a fall by 4 to 5 times. Cognitive impairment can make it difficult for people to be aware of their environment and to make safe choices. Vision problems like cataracts, glaucoma, diabetic retinopathy, and macular degeneration can affect balance. If an individual can't see clearly, they are more at risk for tripping or slipping. In addition, glare intolerance, new glasses, or multifocal lenses can create visual problems. Vision changes with age and can be affected by disease. These changes increase the risk of falling. For example, this image represents normal vision. There are two young boys side by side, each holding a sports ball. This image shows how someone with cataracts might see the image of the boys. It is fuzzy and blurred. All of these visual issues can increase a person's risk of falling. Just in this personal and medical risk factor category, there are numerous risk factors that an older adult may have. Even if genetics, the natural process of aging, chronic or acute health problems can't be changed, good management can help reduce the related risks. The second category is behaviors that increase the risk for a fall, including actions, emotions, or choices of the individual. The fear of falling that we talked about in Module 1 can cause the person to be less physically active. Being less active or making the choice not to exercise will lead to muscle weakness and poor balance, which further increases the risk of falls. Medications, especially pills for sleep, depression, and mood, can be a problem because of the potential side effects like dizziness, drowsiness, and confusion. Older adults taking more than 3 medications, including over-the-counter medications, are also at higher risk due to drug interaction. At the same time, a chronic lack of sleep can cause an individual to be less alert and aware of their surroundings. Too much alcohol and the effect of alcohol when taking medication can affect a person's balance and their decisions related to safety. Poor nutrition and hydration could lead to physical weakness, fatigue, and frailty. Sometimes people take risks and they make poor decisions related to safety. For example, climbing on a chair to change a light bulb if you already have poor balance. Clothing that doesn't fit properly. And inappropriate footwear are also known risks. Not wanting to use assistive devices like canes and walkers, or using them incorrectly, can increase someone's risk of falling. A person's attitudes and beliefs can have an effect on their behaviors. These lifestyle choices and risk-taking behaviors can influence their health and risk for falls. The third category of risk factors is associated with our environment or surroundings. This includes both indoor and outdoor spaces. Indoor hazards include things like throw rugs, loose carpets, electrical cords, clutter, poor lighting, stairs, slippery floors, and no grab bars in the bathroom. These hazards are not only found in an individual's home, they can also be found in institutional settings. For example, the risk of having a fall can be affected by the poor enforcement of safety regulations, the lack of handrails, inaccessible grab bars, slippery floors, the lack of rest areas, equipment that clutters rooms and hallways, and beds that are too high. Outdoor hazards include uneven surfaces, snow or ice, raised door sills, unsafe stairs, poor lighting, slippery surfaces, obstacles and the lack of handrails, grab bars, curb ramps, or rest areas. An older adult may have to deal with numerous factors in their environment that can increase their risk for having a fall. These challenges can be present on a daily basis as an individual goes through their daily activities. The fourth category is social and economic risk factors. Factors like isolation, economic status, language, low literacy, poor living conditions, or lack of transportation do not directly affect balance, but these factors have an impact on an individual's health and access to resources and support. For example, someone living alone with a limited income may not have the financial means to purchase or install a grab bar in their bathroom and may not be aware of available funding. This category is important to consider, even though we do not always recognize these factors as fall risks. In addition to the four categories of risk, there are times when risk is greater. Acute illness like the flu, a urinary tract infection, or surgery can affect an individual's energy level, mobility, and concentration. They are not functioning to their full potential. A change in medication or a new medication may result in side effects or may require a period of adjustment. A new environment, like moving to a retirement home, can create safety issues because the older adult is not familiar with their surroundings. During a time of stress or anxiety, the individual can be fatigued and distracted. Individuals and their caregivers need to be aware during high-risk times and be more attentive and cautious. Public health units and agencies within the Champlain Local Health Integration Network have adopted a self-screening tool called the Staying Independent Checklist. An older adult or their caregiver can complete and identify their risk for having a fall. They are encouraged to discuss their results with their primary care provider. The tool can be found on the main course page under the reference section. This is a summary of the four categories of risk factors for falls. You can consult the Seniors Falls in Canada second report from the Public Health Agency of Canada for more information, available in the resource section. Research tells us that having 4 or more risk factors can increase the risk of falling by over 70%. And it is important to understand that all those risk factors are complex and interactive. Please exit this activity and proceed to Module 3 to learn how falls can be prevented.